Hello and welcome to Patient Power. I'm Andrew Shore. We know where we've been as ePatients. We know what difference that's made as we become powerful patients. We've had better, smarter dialogues with our doctors. But where are we headed now? And what difference can it make? We spoke in our final segment of our interview with Dave DeBronkart, ePatient Dave. We met up with him in Madrid at the ESMO, European Society of Medical Oncology Cancer Congress. Here's Dave.
We have patients involved in IT policy. We have patients obviously here involved in participating in clinical trial design. And we have, one of the things we're discovering in some of the community work in the United States is it turns out that, so one thing we commonly hear when a patient has done some work on Google, and I don't mean stupid things like coming in and saying, I think ionized water will cure my cancer. One woman told that to me once, that ionized water would cure my cancer, right? But if I've done some work and I come up with something and I need to be taught how to evaluate it better, well, that's a burden on the MD, but who says you need an MD to do that, right? So we have people realizing a nurse in the practice can do that, but we're also starting to see community health workers, people who live in the neighborhood, sort of the go-to person, becoming like the local sub-expert who can handle most of that stuff, and they get their advice perhaps from somebody at the doctor's office. And what's really interesting now is we're finding one of the slogans in my book where people say, patients, stay out of that medical information, you won't understand it. I say, well, you know, people perform better when they're informed better, and it's perverse to keep people in the dark and then say they're ignorant. You know, the solution is to develop people's ability. My favorite example on that, which I actually used in a policy meeting in Washington once, was back in the 1950s when my mother was a young mother with 3 children. She had to learn to drive, because in those days most women didn't drive. And in those days, it was very common to have jokes about women drivers who had always wrecked the car, right? Well, surprise, surprise, as women became experienced drivers, today they have fewer accidents than the men who used to make fun of them. The point is, it's a mistake to judge someone's potential by how well they do when they're new at something. If we want to improve how well medicine works, the solution is to develop more competence in patients, and that's what a lot of people are working on.
I'm sure you've been thinking that Andrew and Dave are completely aligned as ePatients, and maybe you too as a powerful patient. How do we all work together? And what are your thoughts? Send them to me at comments@patientpower.info. Again, that's comments@patientpower.info. And remember to be signed up for alerts on our website so you'll know whenever we post something new. I'm Andrew Shore. Remember, knowledge can be the best medicine of all.